Welcome to our channel. Today, we're diving into an important topic regarding prostate health, the impact of certain drinks on an enlarged prostate. Understanding how what we consume affects our well-being, especially for those dealing with prostate enlargement, is crucial. Join us as we uncover the drinks that might worsen this condition and explore healthier alternatives. Prostate enlargement, medically known as benign prostatic hyperplasia, BPH, is a common condition among men, particularly as they age. While medical advice is essential in managing BPH, dietary choices are often overlooked. Surprisingly, what we drink can significantly influence the symptoms and progression of this condition. Today, we're here to shed light on some of these beverages, potentially aiding those seeking to alleviate the impact of an enlarged prostate. An enlarged prostate can lead to various urinary symptoms, such as frequent urination, difficulty starting or stopping urination, weak urine stream, and a persistent feeling of incomplete emptying of the bladder. Certain drinks have been associated with worsening these symptoms or even triggering discomfort for individuals dealing with an enlarged prostate. Understanding the effects of beverages on prostate health is crucial in adopting a proactive approach to managing this condition. So, what role do our beverage choices play in aggravating or alleviating symptoms associated with an enlarged prostate? Are there specific drinks that individuals should avoid or incorporate into their diet to promote prostate health? Let's get started. 1. High-sodium herbal drinks. High-sodium herbal drinks contribute to concerns related to an enlarged prostate due to their sodium content. Elevated sodium levels can potentially worsen high blood pressure, a condition associated with aggravated urinary symptoms in individuals with an enlarged prostate. Excessive sodium intake may lead to water retention and increased swelling, applying additional pressure on the bladder and intensifying urinary discomfort. Moreover, the presence of high sodium in herbal beverages might contribute to inflammation within the body, potentially impacting prostate health negatively. By avoiding or limiting the consumption of such drinks, individuals can reduce sodium intake, potentially alleviating the risk of exacerbating urinary symptoms associated with an enlarged prostate. 2. Coffee. For individuals grappling with an enlarged prostate or BPH, frequent restroom visits can provoke considerable discomfort and at times even pain. The familiar sensation of sipping a cup of coffee and then feeling the urgent need to visit the restroom shortly after is a shared experience. This occurs because caffeine, present in coffee, possesses diuretic properties. A typical serving of black coffee contains roughly 80 to 100 milligrams of caffeine, which can significantly impact bladder activity. Reducing your caffeine intake can notably enhance the consistency of restroom visits. If you relish the taste or the ritual of brewing coffee, consider transitioning to decaf alternatives. Decaffeinated coffee offers most of the flavor without the disruptive effects of caffeine, allowing for a more bladder-friendly experience. These minor adjustments to your coffee habits can effectively alleviate symptoms associated with BPH, contributing to a more comfortable daily routine. 3. Alcohol. Excessive alcohol consumption poses a significant risk to overall health, notably increasing the likelihood of developing prostate cancer. Recent studies have revealed that individuals who engage in heavy drinking are more than twice as likely to develop advanced-stage prostate cancer compared to moderate drinkers. This heightened risk could be attributed to the inflammatory effects of excessive alcohol intake, affecting organs like the liver and prostate glands. This inflammation might lead to cellular damage or abnormal cell death within these vital organs. Moreover, alcohol's diuretic properties exacerbate the urge to urinate frequently. For those aiming to reduce the risk of prostate cancer development or alleviate symptoms associated with an enlarged prostate, abstaining from alcohol consumption entirely is highly advisable. By steering clear of excessive alcohol intake, individuals can potentially mitigate the risk of prostate cancer and lessen the discomfort associated with an enlarged prostate. 4. Fizzy drinks. Carbonated drinks, particularly those high in sugar or artificial sweeteners, might not be advisable, especially if dealing with an enlarged prostate or BPH. Firstly, sugary fizzy beverages can contribute to weight gain and obesity, both of which are risk factors associated with BPH. Obesity, in turn, often correlates with increased inflammation throughout the body, potentially exacerbating symptoms related to BPH. Secondly, fizzy drinks have the propensity to irritate the bladder, intensifying urinary symptoms linked to BPH. Overall, it's prudent to steer clear of sugary and artificially sweetened carbonated drinks if you have an enlarged prostate. Opting for plain water or other non-caffeinated beverages that promote overall prostate and urinary health would be a wiser choice. This helps mitigate potential exacerbation of symptoms associated with an enlarged prostate and supports a more conducive urinary environment. 5. Canned fruit drinks. Excessive sodium intake can pose risks to prostate health, notably found in high quantities in certain canned fruit drinks. While sodium itself isn't inherently harmful to individuals with BPH, elevated sodium intake can contribute to high blood pressure, potentially exacerbating urinary symptoms linked to BPH. High blood pressure can cause damage to blood vessels and tissues, including those within the prostate gland. This damage might lead to inflammation and enlargement of the prostate, intensifying urinary symptoms associated with BPH. Furthermore, increased sodium intake can prompt water retention and swelling, exerting added pressure on the bladder and worsening urinary symptoms. Canned fruits, often present in these drinks, also tend to be high in fructose. Excessive fructose consumption not only contributes to obesity, but also elevates uric acid levels in the body, potentially increasing the risk of developing BPH and exacerbating its symptoms. 6. Hot chocolate. For many, a steaming cup of hot chocolate embodies comfort and relaxation. Yet surprisingly, it's among the drinks cautioned for those with an enlarged prostate. Typically accompanied by whipped cream and added sugar, these ingredients tend to trigger inflammation in our bodies, impacting the prostate glands negatively. However, a favorite drink that contains over 70% cocoa and skips the additional sugar and dairy cream can hold benefits for prostate health. Cocoa, rich in antioxidants, particularly flavonols, can actively reduce inflammation in the body. This makes it potentially advantageous in managing the symptoms associated with an enlarged prostate. When enjoyed in its purer form, free from excessive sugar and creamy additives, cocoa emerges as a favorable option, offering potential benefits for prostate health due to its inflammation-reducing properties. 7. Milk. A study published in the Journal of Nutrition highlights a concerning finding. The consumption of whole milk may elevate the risk of developing prostate cancer and potentially spur its growth. While the evidence remains somewhat limited, exploring alternative, healthier options becomes imperative. Plant-based milk alternatives such as almond milk, soy milk, and oat milk emerge as commendable substitutes for whole milk. Additionally, opting for organic milk presents another healthy choice, sourced from cows raised without the use of antibiotics or growth hormones. Another noteworthy option is grass-fed milk, sourced from cows that predominantly feed on natural vegetation like grass. This type of milk often boasts higher nutrient content, including elevated levels of omega-3 fatty acids, compared to milk from cows-fed diets primarily consisting of corn and soy. Making a switch to these healthier milk alternatives not only diversifies your choices, but also potentially mitigates the risks associated with whole milk consumption, supporting a prostate-conscious dietary approach. 8. Energy drinks. Consuming excessive amounts of energy drinks can significantly compromise your overall health, especially if you're dealing with an enlarged prostate. The high caffeine content in these beverages can easily irritate this sensitive organ and disrupt the body's digestive processes, posing a considerable risk for individuals with BPH or an enlarged prostate. Studies indicate that regular consumption of energy drinks heightens the likelihood of developing bladder issues and severely disrupts the functioning of the prostate gland. As a result, it's strongly recommended to steer clear of energy drinks if you have an enlarged prostate or any related conditions. These beverages can exacerbate symptoms associated with an enlarged prostate, worsening the overall situation and potentially causing additional discomfort. 9. Caffeinated tea. Consuming tea can indeed support prostate health, but it's crucial to discern which varieties provide beneficial properties. Black tea typically contains around 20 to 40 milligrams of caffeine per serving, while green tea holds approximately 15 to 30 milligrams. Managing your caffeine intake from these teas involves opting for decaffeinated versions or exploring herbal teas, which typically lack caffeine. Hibiscus tea, for instance, is caffeine-free and boasts a generous dose of antioxidants, serving as a healthy substitute for caffeinated beverages. Numerous herbal teas, including chamomile, peppermint, and ginger tea, not only serve as alternatives to caffeinated drinks, but also offer remarkable benefits for overall health. These herbal infusions contribute positively to well-being without the stimulating effects of caffeine. By incorporating these herbal teas or opting for decaffeinated versions of tea, you can harness the diverse advantages that tea offers without experiencing any uncomfortable side effects. This proactive approach allows you to enjoy the goodness of tea while supporting prostate health and fostering overall wellness. 10. Citrus fruit juice. Tangy beverages like orange juice, lemonade, or grapefruit juice are renowned for their significant citric acid content. Due to their acidic nature, they have the potential to elevate urine acidity, which in turn can irritate the bladder and the urinary tract. This irritation often leads to heightened urges to urinate and other uncomfortable urinary symptoms. It's essential to adopt a balanced approach when consuming these sweet yet sour beverages. However, if you're an avid fan of these drinks, consider swapping them for fruits that are less acidic or alkaline, offering similar nutritional benefits without the added discomfort. Healthy alternatives such as apple juice, cranberry juice, and pomegranate juice stand out as options with lower acidity levels. Not only do these juices provide essential nutrients, but they also tend to be gentler on the urinary tract and may even contribute to the overall health of the prostate glands. By making this simple substitution, you can enjoy the nutritional perks without triggering excessive discomfort in the bladder or urinary system. If you find this video informative, don't forget to hit the like button and subscribe to our channel for more health tips and insights.